From the last episode, we have gone through some of the key differences between COVID, the flu, cold, and hay fever. If you have not watched the video, I will put the link down below for you so you could watch it later. Today, we are going to talk about antibiotics, antiviral usage in treating COVID, the flu, and cold. We will also be talking about superbugs that can kill you. COVID and the flu are caused by viral infection, whereas a cold can be caused by either a viral or a bacterial infection. We use antibiotics to kill bacteria and antivirals to kill viruses. Antibiotics cannot kill viruses. There are quite a handful of antibiotics in the market, but unfortunately, there aren't many antivirals available. And for antivirals to be somewhat effective, such as the oseltamavir that is used to kill flu virus, it has to be administered within 48 hours of symptoms onset. Reckless prescription of antibiotics by doctors to viral infections have caused and will cause the birth of superbugs, which are bacteria that could not be killed by any antibiotics. The birth of superbugs is a very serious problem for mankind. Our antibiotics and antiviral discovery or invention cannot keep up with the pace of the bacteria or viruses mutating. This is like what we are seeing now with the COVID Delta variant. Bacteria and viruses have the tendency to evolve and mutate for its own survival. If we have nothing to kill them, we need to use our own immune system to fight it. And if our immune system fails, we die. In order to know what antibiotics or antiviral to use to prevent the birth of superbugs, a swab test has to be taken in order to know exactly what is infecting the patient for the doctor to prescribe effectively. Yet, by the time the swab test result comes back, the patient would have already felt better, or the antiviral would be too late to work its course. So sometimes it is pointless to prescribe antibiotics or antiviral. Therefore, in order to slow down and prevent superbugs from forming, many new practices nowadays is to prescribe antibiotics to patients only when the doctor thinks that they need it, such as when the infection has lingered for a long time or the patient has greenish-colored sputum, which is often a sign of a bacterial infection. The doctor would determine this on a case-by-case basis. So when the doctor thinks that it is a viral infection and it is not much that he or she can do about it, he or she would often ask the patient to seek pharmacist advice for symptomatic relief medications, drink plenty of water, and rest to allow the body to fight the infection itself, and to go back to see him or her if the condition gets worse or does not get better. Now, I know many people do buy cold and flu tablets without seeing their doctor. Now, one thing to note, if it is flu season and you have not gotten your flu vaccine and all of the symptoms you have are showing signs of a flu virus infection, there are actually antivirals available that we talked about before that may reduce the severity of your flu symptoms. You just need to get the antiviral into your system within 48 hours of symptoms onset. In other words, you need to see your doctor really early when you get the symptoms. I understand that during a pandemic, many doctors are refusing to see patients with any cold or flu symptoms. If that's the case, try and book a phone consultation with your doctor. Now, there are certain situations where you would need to see your doctor, and some cases you would even need to send yourself directly to the emergency or call the ambulance. I will be reviewing the situation in my next episode. This is a COVID, the flu, and cold treatment series. Please hit the subscribe and notification button so you don't miss out on any of them. Please do give me a thumbs up. I will also be putting out more health-related videos to help improve your health. I do run a second channel where I put out my original music and entertainment videos. If you are interested in it, I will put a link down below for you. Let me know what other questions you have, what other videos you would like me to make, Or if you would like to share any of your experiences or thoughts, please feel free to leave a comment down in the comment section below. It's your pharmacist Sunki here. See you around.